Welcome back in. Well, as we head into Women's History Month and Health Month, it's also an important time to focus on women's health. Breast cancer remains one of the most common cancers affecting women, and early detection can make all the difference. Joining us now is Dr. Helen Mabry with Mercy Health. Thanks for being here today.
Thank you. It's wonderful to be here.
So you've got your pink on. I love that. Yeah. But we're talking about breast health today, specifically because you're a surgical oncologist.
Yes.
So what does that mean? I imagine that means you go in and you remove the cancer.
That's it.
Yeah.
I specialize in diseases of the breast, primarily breast cancer. And when I'm dealing with breast cancer, I'm seeing a lady from the moment that she's diagnosed, and then I help to guide her through surgery and beyond. The thing that means the most to me is the relationship that I have with the patients. She's seeing me at one of the scariest moments of her life, and I help her to find the very best treatment for her as an individual, because she is a mother, a sister, a friend, not just a person with a tumor, and I never lose sight of that person.
Yeah, I mean, who has a huge impact in the people around them. So what are maybe some of the most common treatments or some of the most common types of breast cancer that you treat?
Well, we see a lot of invasive ductal carcinoma, and the main way that we find it is on a screening mammogram, because the changes in the mammogram can happen years before it becomes a lump that someone can feel. So silently, these changes are happening under the surface, but the mammogram can find them, and they can see grains of salt that might be non-invasive breast cancer, or tiny little tumors that have terrible potential, but when they're found early, they can be nipped in the bud.
I feel like we've come a long way, too, with these screenings. Mammograms can really detect a lot, can't they?
Yes, well, we've advanced with the 3D mammogram, and then now we're looking to identify higher risk people so that we can screen them with other methods, including MRI, often alternating every 6 months with a mammogram, or automatic whole breast ultrasound for people who need a test beyond a mammogram because the tissue is too dense, which we hear about all the time.
I may have heard about that before. Yes. So, talk a little bit more about the women who are higher risk. What puts them at that higher risk?
Well, we identify them if they have a strong family history. If other members of their family are diagnosed with breast cancer at a young age, especially under age 40. Or if other members of the family have had multiple cancers. And then we also look at people who've had a tissue diagnosis that showed something high risk, and so we want to keep a very close eye on them, as well as people who have abnormal genetic testing. And these
a lot of people are doing that.
Yes, you can find the BRCA1 and 2 that we heard so much about, thanks to Angelina Jolie. When she shared her status with everyone, that was groundbreaking. But now we know many other genes. There's often 77 genes that are tested for, and they have different potential to cause different types of cancer at different ages. So doing that can help to enhance the screening so that if something does develop, we get it early.
You catch it super quickly, and then that way you can treat it, and your outcomes are that much better.
Yes.
So, and of course, that's what we want. And as we head into March, what proactive steps would you encourage women to take?
Well, one of the most important things is check in yourself regularly. Every month, to be aware of what's normal for you. And then you can know if something changes. And if there's a change, if there's a lump or a change in the shape of the breast, a denting or a divoting, that should be addressed right away. Call in the doctor or come in to see me. This is essential, because what worries me the most are the people out there who have something that they know is abnormal, and they're afraid of what might be involved, and they're hoping it will go away, and they don't seek treatment.
It's not going to go away.
Doing it sooner is better than later. In addition to that, people can have a Mediterranean diet.
Okay.
And avoid ultra-processed foods. They can also exercise, and we recommend 30 to 60 minutes a day. But if someone isn't capable of that, and they can start with a walk.
Yeah.
Yes, 30-minute walk.
Yep.
With a friend.
Move your body, exercise, good diet, get those regular screenings, all of these things. Doctor, thank you so much for being here today.
Thank you.
We appreciate it. And thanks for what you do.
Thank you.
We appreciate that.